Hello and welcome to Ask Dr. Dora. I'm Dr. Dora Dixie, board certified in family medicine and addiction medicine. Ask Dr. Dora Podcast is my virtual medical ministry that's all about addiction medicine, substance use disorders, and the magnificent bodies we live in, where I always say knowledge is power. The more knowledge we have, the more power we have to get improved and hopefully optimal health. We begin with the human body. The body is made from trillions of cells. DNA is the string of hereditary material or blueprint for life inside cells that holds information about how we look and how we act. Chromosomes are tiny structures inside cells made from DNA and protein that tells cells how to function and how to reproduce themselves. Genes are units of hereditary material made up of DNA that gives cells instructions for specific traits like hair texture, eye color, and other functions. Genes are passed from parents to their children, and that is why we look like our parents and often act like them. When we talk about addictions, we often focus on genetics and whether the addiction runs in families or not. With that information, we come to epigenetics, an exciting new field of scientific study, being only 40 to 7 years old, depending on who you read. Epigenetics is the study of how DNA interacts with smaller molecules found within cells that can turn on or turn off genes without changing the DNA. The change in gene expression is not a person's conscious decision. The presence or amount of certain molecules within cells makes the difference. Epigenomes are those molecules affecting DNA expression, which can be the environment, diet, chemical exposure, medications, and social experiences. Epigenomes act like switches on genes. Certain life experiences can leave chemical marks that make people more vulnerable to substance use disorders. Early life experiences, such as childhood trauma or abuse, parental loss or neglect, and even stress in the womb, can change epigenetic control of stress and response genes, making the brain's reward and stress systems more sensitive to drugs later in life. Prenatal exposure may have epigenetic changes in the baby's developing brain that raise the risk of later addictions. Studies on lack of nurturing care show that this leads to epigenetic changes in stress pathways that continue into adulthood. Let's move on to stress and environment. Chronic stress of poverty can change epigenetic marks on the stress response system, increasing cravings or compulsive use. Discrimination or social isolation can leave stress markers on genes that control mood and coping, pushing some towards substance use as relief. Substance exposure itself of early or repeated drug use like alcohol, nicotine, opioids, and cocaine can directly reprogram epigenetic markers in the brain's reward or dopamine system, making it harder to feel pleasure without the drug and easier to relapse. Positive experiences like supportive parenting, therapy, and safe communities can add protective epigenetic marks, helping to decrease risk of developing a substance use disorder. Negative experiences like trauma, instability in the home or community, and any continuous toxic stress can increase the risk of a substance use disorder, by making genes that regulate stress, reward, and self control not work as well. The hopeful part is that the epigenome isn't permanent. Negative experiences add risk for developing a substance use disorder, just like positive experiences push epigenetic marks in a healthier direction. Here are some tips to help you reshape your epigenetic marks in a healthier direction to prevent and recover from a substance use disorder. Nutrition with more plants and less animals in your diet, moderate to vigorous exercise daily, plenty of water, sunshine, temperance in all things, fresh air, and rest. That's 7 to 8 hours of sleep every night, and trust in a power higher than yourself for strength. Thank you for joining me today on Ask Dr. Dora, where I always say knowledge is power. If you want more, please go to YouTube and listen, like, subscribe, and share Ask Dr. Dora. Visit my website, AskDrDora.com, to send your questions, comments, and suggestions. Until the next time, thank you.